All right, hey everybody, Dr. Reinhardt here from Vet Triage. It is Friday, January 3rd, 12:13 p.m. Pacific Time. We are in the year 2025. We are in the last issue, boom, last article here in JAVMA, February 15, 2017. This is going to be a long one, and it's about cows, so brace yourself. Incidence of lameness and association of cause and severity of lameness on the outcome for cattle on 6 commercial beef feedlots. This comes out of Kansas State University as well as Zinpro Corp in Minnesota. At the bottom there, I have a definition for days on feed because it's part of this article and I wasn't sure what that meant. There are going to be other phrases in here that I'm not that familiar with because it's all beef cattle. But anyway, for those who are interested, I'm sure it'll make more sense to them. And for those who aren't interested, you probably aren't watching this. The objective: to describe the incidence of specific causes of lameness and the association of cause and severity of lameness on the outcome for cattle on commercial feedlots. So just to be clear, these are beef cattle, so they're being raised to be sold for like slaughter, for meat or whatever, right? So has to have a different mentality with this than most of our journal articles, which are about like helping the patient recover and get back to health and all that. Procedures: feedlot personnel were trained to use a standardized diagnostic algorithm and locomotion score system to identify and classify cattle by cause of severity and lameness. The reason why you want systems like this, scoring systems, which is actually in the picture there in the thumbnail, is because you want to have as objective of a measure as you can when you're trying to assess something, whether it's lameness or pain levels or being in a coma, whatever it is. And so you also want a system that's not only objective, but also can be easily applicable by anybody, not just doctors. Cattle were monitored until they left the feedlot, and the outcome was either shipped with pen mates, so they were shipped, culled prematurely because of lameness, which is called realized, or euthanized, or died, and they call that died. Results: overall lameness incidence was 1.04 cases per 100 animal years. Realized and mortality rates were 0.096 cattle per 100 animal years and 0.397 deaths per 100 animal years, respectively. Injury to the proximal portion of the limb, meaning higher up in the limb, was the most frequent cause of lameness, followed by undefined lameness, septic joint, deep digital sepsis, interdigital phlegmon, or foot rot. As the lameness severity increased, the percentage of cattle that died but not the percentage of cattle that were realized increased. So those are the conclusions. Introduction: lameness accounts for 16% of all morbidity in beef lots and up to 70% of lost revenue associated with premature, also known as salvage slaughter of cattle because of chronic injury. Cattle that develop interdigital phlegmon, which is foot rot, at any time during the feeding period have a decrease in average daily gain of 0.02 kgs per day or 0.044 pounds per day and require 5 additional days to achieve a finished slaughter weight compared with cattle that do not develop foot rot. However, cattle that develop foot rot during the last 120 days of the feeding period have a decreased average daily gain of 0.05 kgs per day, which is 0.11 pound per day, and require 14 additional days to achieve their slaughter weight compared to those without foot rot. Thus, it appears that the negative consequences of foot rot on production increases as the days on feed at which the condition is diagnosed increases. So they're saying if you have a sick animal, it takes some longer recovery, requiring more resources and delays their slaughter. 58% of respondents in another study considered lameness in the feedlot to be a welfare concern, and 20% considered lameness in feedlots to be a growing concern. The incidence of foot rot was 6.5% throughout the mean duration of 262 days of the feeding period. Estimated annual prevalence of digital dermatitis in feedlot cattle is 0.01%. Materials and methods. They assessed 6 large commercial beef feedlot operations, which had an operational capacity of over 20,000 cattle. The study was designed from 2012 to 2013. They used a 4-point lameness scale developed by Kansas State University Beef Cattle Institute. The scoring system was based on individual animal stride length, head movement, willingness to move, and bear weight on the affected limb or limbs. So stride length was evaluated by comparing the symmetry of the distance and placement of the front and hind feet of the left side with that of the right side. Head movement was evaluated on the basis of presence or absence of a head bob, which is defined as an abnormal lifting or dropping of the head. Briefly, cattle that were not lame were assigned a score of 0, and the ones that were severely lame, 3. The cause of lameness included an algorithm that were foot rot, digital dermatitis, also known as hairy heel wart, laceration of the foot or hoof wall, laminitis, septic joint or deep digital sepsis, sole ulcer or abscess, toe ulcer or abscess, and then lameness associated with the injury to the proximal limb, and then finally undefined. And then of course we have the algorithm here they were using. So you can pause the video and take a look at that if you care about the details there. But that was the diagnostic algorithm used. Okay, results. And by the way, look how much underlining there is here. I mean, I underlined the entire paper because like all of it has important data to it, and it's not a subject of expertise for me, so it'll be a lot. But here we go. Results. The mean daily population of all 6 participating feedlots was 24,062 cattle. Mean body weight was 334 kilograms or 735 pounds. The lameness was identified in 2,532 cattle. Overall incidence of 0.04 cases per 100 animal years. The mean days on feed at lameness detection was 57 days. The most frequently identified cause of lameness was upper limb, 36%, followed by undefined lameness in 27%. 38% of cattle died or were euthanized because of lameness. Overall lameness mortality, 0.397 deaths per 100 animal years. The mortality rate was greatest for cattle with undefined lameness, which was 0.161 deaths per 100 animal years, followed by upper limb lameness at 0.119 deaths per 100 animal years. For the 968 cattle that died or were euthanized, the mean days on feed was 58 days. Mean days on feed at death was 74 days. Mean interval between lameness, identification, and death was 16 days. Cattle with a toe ulcer or abscess had the lowest mean days on feed at lameness identification of 14 days, and the longest mean interval between lameness identification and death was 31 days, whereas cattle with digital dermatitis had the highest mean days on feed at lameness of 104 days, and cattle with upper limb had the shortest at 10 days. So essentially what this is saying, if I'm reading it correctly, is depending on the disease, mild disease versus severe disease diagnoses, determined how long they were going to be days on feed. The mean percentage of cattle with a septic joint or deep digital sepsis that were dead or euthanized at the time of lameness was 32.9%. That was significantly greater than that of cattle with foot rot at 12.4% or toe ulcer abscess 14.9%. The mean percentage of cattle with a sole ulcer abscess 28.8%, undefined condition 24.2%, or upper limb lameness 21.6% that were dead or euthanized at the time the lameness was identified was significantly greater than that with foot rot. 230 of the 2,532 cattle identified with lameness were realized or sold for slaughter prior to their pen mates for salvage purposes, resulting in an overall realizer rate of 0.096 cattle per 100 animal years. The condition with the highest proportion of cattle realized was digital dermatitis at 24%, then undefined at 12%, upper limb 11%. The mean percentage of cattle with undefined lameness at 8.5%, upper limit 8.1% that were realized at the time of lameness was significantly greater than that for cattle that had foot rot at 3.1%, laminitis 1.8%, sole ulcer or abscess 2.3%. Now, retreatment rate. Of the 2,532 cattle, 91% were treated once, 4.6 twice, 4.4% 3 times or more. The mean number of treatments administered did not differ amongst causes of lameness. The association of the score with outcome. 22.2% of cattle were assigned a score of 1. 31.4% had a score of 2. 22.7% score of 3. The remaining 23.7% were not assigned a score. A score of 3, which is 33.3%, were of those that were dead or euthanized at the time of lameness detection, and that was significantly greater than a score of 2 at 19.1% or a score of 1 at 10%. But did not differ significantly from cattle that were not assigned a score. Likewise, the mean percentage of cattle with a score of 2 that were dead or euthanized was significantly greater than that for cattle with a score of 1. The mean percentage of cattle with a score of 1, which is 6.4%, that were realized at the time of lameness detection did not differ significantly from that of cattle with a score of 3, which is 6.67%. But it was significantly greater than that for cattle with a score of 2, 3.67%, or those that were not assigned a score at 3.6%. The association of season with the outcome. So lameness in the winter, 29.7% that were dead or euthanized, was greater than that, significantly greater than that for cattle that were identified in the spring at 19.4%, and the summer at 18.3%. Did not differ significantly from that of cattle that were initially identified as lame in the fall at 20.1%. Likewise, the mean percentage of cattle that were initially identified as lame in the fall that were dead or euthanized did not differ from cattle that were diagnosed in the spring or summer. The mean percentage of cattle that were initially identified as lame in the spring, which is 9.76%, that were realized at the time of detection was significantly greater than that for cattle initially identified as lame in the fall at 3.45% and winter at 3.25%, but were not significantly different than those identified as lame in the summer, which is 6.13%. Likewise, the proportion of cattle that were initially identified as lame in the summer and realized at the time of detection did not differ significantly from that of cattle that were initially identified as lame in the fall or winter. All right. Estimated revenue lost because of lameness is the final section here. The mean body weight at feedlot arrival for the study population was 334 kilograms, and the mean days on feed at the time of death was 77 days. Revenue lost because of lameness-associated deaths was estimated at $0.55, so 55 cents, per animal month, or $6.60 per animal year, and this is in U.S. dollars. The estimated revenue loss for cattle realized because of lameness was $0.06, so 6 cents per animal month, or $0.76 or 76 cents per animal year. Thus, the estimated loss of revenue associated with lameness because of death or premature realized slaughter was $7.36 per animal year. Okay, discussion. 13.1% of feedlot cattle developed a health problem during the feeding period, and 16% of those health problems were associated with lameness, resulting in a lameness incidence of 2.09%. In the present study, lameness was 0.04 cases per 100 animal years, which makes up 1.04%, and it's approximately half of the previous study. Incidence of foot rot in steers over the mean duration of the feeding period of 262 days was 6.5%. In the present study, the incidence was actually 0.09%, so again, lower. Historically, foot rot, injury, toe ulcer, abscess have been considered the most common causes of lameness. 42.2%, 35.4%, and 9.5% perceived that foot rot, injury, and toe ulcer or abscess, respectively, was the most common cause of lameness in feedlot cattle. And so just to reiterate that, foot rot was the highest at 42.2%, injury at 35.4%, and toe ulcer or abscess 9.5%. Interestingly, in the present study, the most frequently identified cause of lameness was upper limb, with an incidence of 0.37%, undefined at 0.28%, and septic joint or deep digital sepsis at 0.11%, whereas foot rot was only 0.09% and toe ulcer abscess 0.05%. The prevalence of lameness for steers before processing, meaning routine vaccination, treatment for internal and external parasites, application of ear tags, and other procedures such as dehorning and castration, which is 1.6%, at feedlot arrival were significantly less than that immediately after processing at 2.5%. Of those 3,243 steers, 120 or 3.7% were treated for lameness during the first 100 days on feed, with 0.15% classified with foot rot, 1.94% as classified as bullers, which are steers that are ridden by other steers in a pen, 1.39% classified with a musculoskeletal disorder, and 0.22% with arthritis. The rate of lameness during the first 100 days on feed was 1.76%. The incidence of rate of lameness for those steers over the entire duration of feeding period was over 1.76%, which is greater than that of the present study at 1.04%. Lameness was attributed to 70% of cattle that were realized and 5% that died. In the present study, the estimated loss of revenue associated with lameness because of death or premature realized slaughter was $7.36 per animal year. Thus, the estimated loss of revenue because of premature slaughter or death due to lameness of the 6 feedlots over 12 months was $1.8 million, which is 243,602 animal years times $7.36 per animal year. Moreover, the estimate is simply lost revenue. It does not account for drug and labor costs associated with treatment of lame cattle. So almost $2 million lost. This is why you got to take care of these cattle. See, anytime you hear about like animal abuse cases because of food production animals, it's dumb of them because you could argue that, well, they're being abused because they're trying to speed up the assembly line. Sure, probably, or maybe people are just mean or evil or whatever. But financially, doesn't make any sense. It makes more sense to have healthier animals that are taken care of financially and also ethically. So this is a dumb, short-sighted way that we handle these animals. One of the first scoring systems developed for cattle was a 9-point scale, ranging from 1 to 5 with 0.5-point increments. Then they made a 5-point scale focused on gait and extent of the arch of the back. Then another study developed a 4-point system, ranges from 0 to 3, and includes evaluation of the head movement, the head bob. In the present study, the mean percentage of cattle that died increased significantly as the score assigned at the time of lameness increased. There's an inverse relationship between the scoring and the probability of a favorable outcome, meaning they were shipped versus realized or died. In the United Kingdom, the mean prevalence of lameness is 5.73% when subjectively estimated by producers, compared with 22.11% when cattle were objectively assessed as lame or severely lame by using the scoring system. In another study, 1,404 of 9,299 beef cows, which makes up 15%, and 15.4% of beef bulls marketed in the Western United States in 2008 were noticeably lame. So overall, proximal limb was most common in this study, followed by undefined, $1.8 million revenue loss for 1 year, and the higher the score, the more likely they are going to be to die or euthanize. And that is it for this journal. So we're going to move on to the next one tomorrow. This one is done. And thanks to those who are watching. We'll see you in the next one. Take care.